We've made a lot of progress over the past couple of months. Behind me is the north facade of the new hospital. As you can see, the exterior is predominantly done. There's some minor corners that they still have to put the stone on, but for the most part, it is done. The other things that we have completed are the underground utilities have been completed. The generator has arrived and been installed. Next up are finishing the exoskeleton of the porte cochere and finishing the interiors. On floors 5, 4, and 3, the overhead utilities are predominantly done with some minor tweaks here and there. They're going to then work on the framing as well as the drywall and the in-wall utilities. That is going strong, and we expect that to be done over the next few months. The second floor is the final floor to start, and that will be done over the next 2 to 3 months. We are on 5th floor, which is where the inpatient rooms are. Walk this way. Hi there. So here's an example of one of the patient corridors. We have 16 rooms. Here's an example of one room. If you come this way, so this is the south side. They have patient rooms on this side. In the middle is going to be the nurse's desk. This will be the two faces. This is the south side, and the north side is on the other side. Come this way. We're walking around to the north side of 5th, and you can see examples of patient rooms here. So walk in here. So here's an example of a patient room. Come on in. Each room has its own private bathroom. The patient bed is going to be here. The head of the bed facing this direction where all the utilities are behind the patient. Each room has an amazing view. You can see this is heading north. You can see the Hollywood Hills, and to the east is downtown. So this is 5th. We're going to head down to 4 next. On any given weekday, it's a beehive of activity. We have over 100 workers from various disciplines here at any given time. We are now on the 4th floor, which is where the ORs are. I'm going to walk you through the patient journey. Patients are going to come up this elevator, come through pre-op and PACU in this direction. This is the pre-op and PACU holding area, so there'll be a total of 14 beds. The heads will be against the windows, feet facing us. Patients will come in here. They'll change into their gown and get ready for surgery. Once they are on their bed, they'll come in this direction, heading into the operating rooms. As you can see, the overhead utilities on 4th is pretty much done. There's a maze of pipes and ducts that are involved in all the various items that it takes to run a hospital. These are the overhead utilities. There are 4 rooms, 4 operating rooms. Here's one. You can see the overhead Sterile filtration system. This is a HEPA filtration system, and each of the ORs has one. OR number 3, and then walking over here, this is OR number 4. Each room is about 625 square feet, which is more than big enough to have all of the amazing equipment we use during surgery, including all the fluoroscopy machines, the robots, the anesthesia machines, and any other equipment that the surgeon needs in order to do their hip or spine surgery. You can see the HEPA filtration system above. We are now on 3. This is where the conference center and the SPD is. The SPD is Sterile Processing Department, where we sterilize all the medical equipment we use during surgery. As you can see, the drywall is up and the overhead utilities are done. Walk with me here. We're walking into the conference center. Overhead utilities, ducts, piping, etc. That's all done. They're working to finish the drywall. This is the conference center. Come this way. And we're now walking into SPD. So the overhead piping, including water and gas and AC, are done here. They're going to put up the drywall, and then after that, bring in the equipment that we use to sterilize the tools that we use for surgery. Walk this way. We are on one. This is a 2-story lobby. The main entrance to the hospital will be here. But I want to show you the elevators have arrived. Come with me. The elevator shafts, there are 4 total elevators. These are the 2 visitor elevator shafts. On this side are the patient and transport 2 elevators. You can see the elevator for the transport elevators is much wider and deeper. Take a look up there. Come this way. We have 4 Otis elevators, and there they are. They're starting to be unpackaged. As you can see, they're obviously in pieces, but they're going to come in and start inserting them into the shafts we pointed out. Here are the rest of the crates for the elevators. Show you the generator. There's the generator. To my right is the day tank. There's a 1,000-gallon diesel tank that is buried under the surface parking. There's a conduit that connects to the day tank, which then feeds the generator. Generator, American company, Caterpillar, based in Peoria, Illinois, which is where I did my medical training. When the generator turns on, it feeds power to all of the critical structures in a hospital, including things such as life support and emergency power. The exhaust from the diesel generator gets passed into this filtration system where it gets scrubbed, and then there's an exit pipe that goes to the roof that the exhaust then gets pushed out at. Overall, we made a lot of progress. We're on track, and we're excited to finish this by the end of this year to the beginning of next year.